To start off, I'm Talia. I use she, her pronouns. And Leith, is it all right if I start with you?
Yeah.
Could you talk a little bit about your experience within the healthcare system?
Well, before I started doing what I do now in entertainment, I actually worked at Callan Lord Community Health Center in New York for 3 years. So I working there is where I actually learned how to navigate healthcare for myself because I think that for my transition, had I not worked there, I feel like I would have had a tougher time navigating it because it's not really that simple unless you know where to go and what questions to ask. So even still, I remember when I was beginning my transition and I was going to, well, first of all, I guess let's backtrack to when I first started. So I was working at Callan Lord. I knew what questions to ask, and I also had other trans people that were my coworkers that I could go to and ask about physicians that were competent and would offer proper care. And because we worked at Callan Lord and it was a very safe and open queer space, they also provided their employees with the best health insurance, I think, in New York at the time. And it paid for all my hormones. It paid for top surgery. So I didn't have to come out of pocket for anything at all. And then I think after the Affordable Care Act came around, Medicaid, for those that qualified for it, started covering a lot of those same things. But a lot of people didn't know that they qualified. A lot of people didn't know that they could just go in with a navigator and they'd help them fill out the application, and it just seemed very scary to a lot of folks. Um, but once I started, because I was an employee at Callan Lord, I couldn't access care at Callan Lord, so I had a private doctor that was seeing one of my coworkers as well, and a few other trans people in the area, and he was great. Like he knew how to treat us, made me feel. He knew what pronouns to use even before I started hormones. He also guided me with what to look for when looking for a surgeon. But then I also asked a lot of my peers, and I did a lot of my own research. The problems that I encountered were with emergency care. I remember I injured myself either playing basketball when I was younger, and I had a lower back injury, and I re-injured it again once I started weightlifting. And I went into the emergency room because I was having like very excruciating pain. I could barely move. And I remember going with my dad. I mentioned to the receptionist that I had been there before, so my records are already there, but it's under female because it was before I changed all of my documentation, and I let them know I'm trans. All my documents are now male. So if you can fix that or correct that in your system. And I gave them my ID and my health insurance cards and all of that. And as I waited, I just saw the group of nurses in the nursing station, kind of like speaking amongst themselves, kind of laughing and like getting up out of their nursing station and looking and staring. And then when I was called to go into the examination room by one of the male nurses, who was also, he was cis, but he was in the community. He was gay. He was like, "Ooh, I would never have been able to tell." So convincing. And I was just taken aback. It was like really, it was awful. And what year was this? This was 2015. So it wasn't that long ago. And then going after he took my blood pressure and exited, with my dad, I waited for the doctor to come in so they can take some x-rays of my back. And the doctor wouldn't get close to me. He didn't want to touch me. He kept questioning who the man that was with me was, and I'm just like, that's my father. Like, he is my biological father. He's my dad. And he was just like, very standoffish, and was like um asking me about things that had nothing to do with the injury, and just made me feel very uncomfortable. And what I ended up doing was I was just in the pain that I was just like, I don't feel comfortable here anymore. I was like, "Dad, let's go." And he helped me off the examination table and out into the car, and we left. So we ended up having to, I made an appointment with my primary care doctor, and he gave me like some pain meds that helped And then I was able, and then gave me a referral to see a specialist, and they ended up helping. So my experience in the emergency room was not great, and that was at St. Luke's Hospital in New York. Because of there's more to the story. Because I also, and I know I'm like trying to remember all the things that happened. Because I worked under Finn Brigham at Callan Lord, who does a lot of trans sensitivity trainings in the city. I accompanied him a couple of times to do some sensitivity trainings at some homeless shelters. And I contacted him and asked him if he could help me with writing a letter to the hospital to tell them about sensitivity training because of my experience. And the person that got back to me said, we already do trans sensitivity trainings. We don't know what you're talking about. So they were also very resistant to that as well. So it wasn't the best experience, and it made me very, very uncomfortable.
And that experience inspired you to, well, to figure out, like, the research that you did in working with your primary care physician, it led you to other forms of healthcare that could support you. And what forms of healthcare in your research did you figure out, and what did that process look like of
Well,
discovering?
I mean, healthcare for trans people is like healthcare for anyone else. It's just, for me, it was just finding competent people. And even if they hadn't had direct experience treating or working with trans patients, that they were open to just listening and like treating me like a human being, not like some freak show, which was what I felt at the St. Luke's Hospital when that incident happened. Um, so it was just, I mean, I know that I'm not the only one that has felt this way, where you're just kind of afraid to go to the hospital even when you're sick, because you don't want to deal with people either misgendering you or looking at you funny or not wanting to see you because you're trans, or be like making a mockery out of you, or laughing or snickering or whispering. And it's not always at hospitals. I had a similar experience here at the LA LGBT Center. So I went to that space thinking, oh, these are competent people, these are queer people, they're LGBT, they're used to seeing people like me here. And I had I remember it was, and I'll be very transparent. I had a gynecological concern. And then obviously me looking the way that I do and presenting myself, which I thought wouldn't be a huge deal at an LA LGBT center. The same thing happened. Some nurses were like snickering, like coming into the room and trying to like see what I look like. And I was just like, excuse me, that's unprofessional. You have trans people on your staff. Like, why is this a big deal? Well, I'm trans, yes. It was like, what the, so I had that experience there. But I kind of like let it slide. They gave me a referral to see a specialist. And when I went to see the specialist for the issue, that the woman that I saw, it was at a women's clinic, but she was very respectful. She told me that I was the first trans person that she had treated or dealt with in that particular setting. And she never misgendered me. She was very gentle, and she was very open and asked questions and asked me, to answer questions that she had, which I felt comfortable answering. So that was actually a great experience. The issue that I had there was now with insurance. So because I was having um, treat something done that's for women or for females as listed under insurance, my insurance wouldn't cover it because all my documents said male. So I kept getting billed for this scan, and I'm just like, no, I'm trans, it's okay. And they were like, well, we're gonna have to switch your insurance to female then. And I was like, well, you can't do that because my license, my social security, everything else is male, so you can't. So it was maybe a 6-month span of me going back and forth, receiving bills and calling insurance and calling the people that were billing me, saying, like, you guys figure this thing out. It was very frustrating, but they finally figured it out. So all that to say, there's still not things aren't perfect. and navigating it. And this is for me, and this is someone that has access to care, someone that has health insurance, someone that kind of knows how to navigate, knows how to speak to all these people. It can still be difficult. And that's why when Rocco reached out to me about joining and helping promote Folx, which is, very much so trans and non-binary and queer sex-centric healthcare, I was really excited to jump on board.
How could I safely self-identify in a medical setting? I understand that there's lots of medical settings that kind of make it impossible, but what are the best methods to go about safely self-identifying?
By safely self-identifying, do you mean like coming out or stating that you're trans to your provider? Well, that's a tough question. For me, I I've never not told a provider that I'm trans because I felt that it would be a disservice to myself and to other trans people that may come into that particular place to receive care. So I don't know. I can honestly say I'm not quite sure. So because, and also I don't know. I don't. It's hard. That's hard to explain again. So I always tell my healthcare provider that I'm trans. Even if what I'm going in for has nothing to do with my transness, just because I want the provider to know that they have treated a trans person before. And I'm aware that I'm not always visibly trans, or I'm not, I mean, I don't think that I'm visibly trans. I don't know, people call it clocky. I can use like the non-PC terminology, which is what folks would say, like, oh, no one can clock you. And I was like, okay, that's great. But I'm very proud of my identity. And I know that me being out as a public figure is important. And even in this setting that's supposed to be private with you and your physician, I think that them knowing and them being aware that they're treating a trans person, so that they're not, I guess, for any other person that may come in that may be in the beginning of their transition, or someone that's non-binary, or someone that is visibly trans, they can say, okay, I've treated a trans patient before, and maybe whatever misconceptions they may have had beforehand can go away, or maybe they can work on it in interim, so they can do some research that they probably wouldn't have done because they think that they had never met a trans person or cared for a trans person before.
Yeah, like that physician that you mentioned that said, "You're my first trans patient."
Right. And she was, like I said, she was wonderful. And I've also had other providers. Once I stopped working at Callan Lord, I started receiving care at Callan Lord in New York. And two of the providers that were new to working there, they were cis straight women. They had never worked with trans patients before. And because I was a previous employee, and because I was already on hormones for about 4 or 5 years at the time, they asked me a lot of questions about my changes and about my transition, so that they can help with the younger guys that were coming in.
That's amazing that you were able to help educate.
I mean, I try to do what I can.
Yeah. Kate, I don't know if we're in charge of turning on your video, but I'd love to bring you in for these next couple of questions.
Sure. Yeah, I can't turn on my video on my end.
All right. Okay. So we're gonna, I think, make you co-host and get that going. But please feel free to answer until the video.
Okay.
Hopefully that'll be soon. Leith kind of got into this, but a lot of people don't have healthcare, get hormone treatment on the streets. What are some safety measures that they can take if they don't have access to something like Folx?
Yeah, I think that's a It's a great question. And obviously in an ideal world, and what I hope most of us are striving for and working for, is universal healthcare. So everyone has access to affirming healthcare all the time. But I think that there's a few different things when I think about people who, let's say, who are accessing hormones on the streets, right? First of all, I think when I'm a provider of someone and they have a history of accessing hormones outside of the medical system, what I want to do as a provider is not demonize that and not put that in a way that's like, oh, that was illegal or that was not covered under this medical care. I think the main thing is just to be as open as possible to say, look, however you had to access healthcare before is exactly how it had to be for you. I'm sorry that it had to be that way. I wish that everyone could have access, but let's go ahead and figure out a safe way to, are there labs that we can go ahead and do with you? It looks like I can now put my video on. Okay, good. Hi everyone. I'm here. Trying to bring and welcome somebody in who might not have been inside the healthcare system to say, like, it's totally fine where you were, and we're going to create a welcoming spot for you here. I think the main thing is looking at it from, kind of a harm reduction model in all things for healthcare, right? So we have to meet people where they are and help people be able to access the care that's going to be safe for them and that's going to be affirming for them. There's plenty of places, when we think about Folx and what we know, that we're not accessible to everyone, like not everyone can pay out of pocket, right? But we are able to, we have a healthcare and HRT care fund to be able to fund that for people who have that necessity. I think there's plenty of other places that also people can access care from a sliding scale perspective. There's clinics that are around. Planned Parenthoods have plenty of like sliding scale. Obviously that comes with the burden of having to wait for appointments and all of those pieces. But, one other thing that I actually looked at too, right before this, was the Transgender Legal Defense Fund has an actual insurance tutorial and like a process like on their site about being able to figure out what is the best type of insurance. If you're looking at the affordable healthcare market, what type of insurance is the most going to be most trans inclusive? Where can you get the care that is like, what type of insurance would help get coverage? Because we all know that different plans are going to cover different things. And then obviously it's state by state as well in terms of regulations about what kind of care is covered for people.
Leith, you have anything to add on just the ways that people that you know or have heard of have accessed safe hormone treatment outside of a healthcare system, like folks?
I know that for the most part, all of the folks that I know would access healthcare through some sort of some sort of LGBT center in their home town or city. And the issue with that is that if you live outside of a big city, the closest place might be miles away. So I remember even while working at Callan Lord in New York, we had a lot of patients that would come in from out of state to receive care, mostly young folks. So young people coming into the HOT program, which is health outreach to teens. They would come in from upstate, sometimes from even, I think one patient was from New Hampshire, was coming into New York to receive care and to access hormones because they couldn't wherever they were. So I think that what Folx does is it allows for people to access care from their homes. Obviously, if they need to see a physician in person, that's something I think that can be worked around. But for trans-specific care, at least accessing hormones and learning how to navigate their transition or your transition, Folx has a lot of resources for that.
I know that you spoke a bit about this when you and your father left St. Luke's, but how do you safely exit, or how do you just get out of an appointment where you feel unsafe?
Well, I know that, I mean, again, I can only speak on my experience. I've always been the type of person that really, I kind of don't like being disrespected. I know no one does, but when I am, or if I feel unsafe, I'm the type that I will say something and I will walk away. But I know that some people might be afraid, and I'd say to those folks, like, do not be afraid. You do deserve to be treated like a human being, because we're all human beings. You deserve to be treated with respect, especially in a healthcare setting. Um, I mean, I'm not a healthcare professional, but I know that there's an oath that's taken that you're going to treat your patients, and it doesn't matter where they come from. It doesn't matter what their sexual orientation is, or gender identity. That's your job, is to help people. So if you have such an issue with an individual that's, for lack of better words, it's different, or doesn't fit what you think should be something someone should be, then you have the wrong career, you know?
Yeah, I think that's a really great point, Leith, especially when we think about like medical schools, nursing schools, like for healthcare providers who are getting education. And often it's about the special population, right? Like, let's do the one, class on how to treat trans people, or let's do the one. And like, when you think about people as a special population versus like, let's just treat everyone so everyone feels included and supported and empowered, that's a totally different model, right? If you think about, there's plenty of clinicians out there who are going to say, well, I don't know how to treat a trans. Well, of course, they have a body. And it's the right body, and it's their body. And all you have to do is make sure that the questions that you ask are encompassing enough and empowering enough for every single person that you're sitting in front of to be able to respond and not feel excluded, right? So I think about the ways that I ask questions when I'm doing, in the ways that I've trained people in the places that I've worked in to ask questions about sexual history, about the type of partners that they're having, the type of sex that they're having with the type of partners that they have, and asking it in a way that nothing is ever assumed. I think that's where we get into these problems, and where most people who went through, let's say, a healthcare system, a medical care system, training system, when you think about small populations, you think, well, if I'm not dealing with that population right then I don't need to ask my questions this way. And then you're going to be encountering people who are going to feel excluded because you're just not asking the questions the right way, right? So I think, again, making a broad overview of, we ask intake questions that are pertinent to the person in front of you, what they're there for. We ask questions in an open-ended way, so we are never assuming who that person is, or who they're encountering, or who they're having sex with, or any of those pieces. And we respond to the way that they ask their questions. Also knowing, as a healthcare provider, I can never assume, given especially with the trans population, I can never assume that people are coming to me trusting me. I can't assume that, because guess what? Most of the time they've come across people who are not trustworthy. They have exactly what you were saying, Leith. They have taken care of them in a way that shows that person, that individual person, that person did not put them first. That person did not respect them. They did not empower them with their care. And so myself as a clinician, my job is to create a situation where I'm never going to assume I am going to be someone you trust right away, but I can create that with you. And I can create a situation where, like, over time, you're going to understand the way I ask questions, the way that I respond to you, and the way that I care for your whole self, that I can be someone who's trusted, right? And then we can kind of build that system together and see how that works, because it's, it's a phenomenally, it's, when I say it this way, I don't mean to, like, it's a phenomenally easy thing to do, right? It's actually really freaking easy to be open and understanding and welcoming of people, and not to exclude them. But you just have to change your framework. You can't sit in these binaries of like the way that the medical establishment is created.
Yeah, I've encountered similar things working, like doing my advocacy work for HIV. I remember going to DC and doing a talk on HIV and how preventative care needs to include women, cis women, and transmasculine folks. And I got questions from clinicians saying we don't know how to reach them, and I was like, "What? What do you mean? You're making assumptions about how people have sex, for example, and assuming that if a cis woman who identifies as a lesbian is having sex with or relations with other women, then they are not at risk of HIV, and therefore I don't have to ask them any questions about prevention." And similarly, they did the same thing. They would do the same thing for trans men. And then they started seeing that there were numbers were going up. And that's because trans men specifically weren't necessarily being targeted when they were doing anything about prevention. So it just goes hand in hand with what you were saying about making those assumptions about individuals, and also not including them in any type of pamphlet or any information that you're trying to put out there for preventative care. We all have bodies, and there's a risk for anyone, especially if they're sexually active. So you need to know how to protect yourself.
Yeah. Yeah. And I think about the way of asking, well, like we want to be able to create a place where people's identity is feeling seen, but we're actually asking questions about people's behavior, right, as well. Like it's not, like I want to make sure that somebody who identifies as a lesbian, I honor and support your identity. And I'm going to ask about your behavior on that, because I'm not going to make assumptions just because you told me that you have an identity as a lesbian, that you're not at risk for pregnancy, that you're not all of those pieces. So it's like, how do we respect and empower identity and actually get at the core of what people are at risk for based on behavior, based on lifestyle, all of those pieces.
So just now, the two of you definitely touched on this, but what are some of the fundamental gaps in the training of healthcare professionals when it comes to these LGBTQ+ issues?
I think Kate would be better equipped to answer this one.
Yeah, I mean, I would say it's like, when I think about who we're hiring as clinicians at Folx, right? We are hiring people who are part of the community. They are trans, they are queer, they are also experts in that care. I think the main thing is it's like, I wish that I didn't have to make these, like, I didn't have to go out and search, like, are you trans competent and are you queer competent? I wish that was part of the like air that people breathed at a medical school, at any kind of training. It isn't. So oftentimes what has to happen is people get those competencies and get that expertise on the job in training, right? Or they seek it out themselves. They go to conferences, they do all these things. So I would say, in answer to your question, what are the gaps? The gaps are that, one, like I already talked about, it's talked about as a specialty instead of like incorporated into every single piece of medical care, right? Identity, behavior, and all of the pieces of a person are incorporated into every piece of medical care. And so like when Leith's saying, when you walk into the emergency room, it's not a trans person walking into the emergency room. Sure, if it's about their trans identity or something about their body part, but like it is really about being able to identify like the entirety of a person and approaching them with respect. And again, that's not how it's set up in medical school. It's like so siloed in so many different things. Like, let's go have a class on diabetes. Now let's have our class on trans people, right? And so again, that's the kind of thing where we're trying to figure out, and I'm not to say across the country this isn't done well. There are places in medical schools that are trying to work on this, but how do we make sure that every lecture and every piece has a trans competence and a queer competence that is ingrained in like the foundation of it? And so that people don't have to go source out those expertise, source out that expertise themselves, because when you are self-choosing to be an expert on trans care, then what happens is all those people who went through medical school and got their degrees are out there in the field seeing trans people, because trans people and queer people are everywhere. And if they had to search out that expertise instead of it being part of the school that they were in, then that is completely leaving all of the trans people at risk, right? It's leaving them at risk for encountering people that don't have that expertise.
And then also it's overpopulating the LGBT centers that usually have grants for folks that need that care or maybe can't afford care. They're overpopulating it with people that do have health insurance and they can probably afford a private physician elsewhere, but they don't feel comfortable going to that private physician because they're not competent.
Yeah, that's a great point.
Kate, could you talk a little bit about the work you've done with regard to implementing services and access?
Yeah. So when I think about implementing a new service or training people on that, obviously especially when we think about this as at Folx, the first thing is like, what does the community want and need? What are the needs that we're trying to fill? And sourcing that from the community that we're serving, right? Like, they are the experts on what they need. They can identify the gaps. And then we go ahead and help create that and fill that need. And so it's very different than kind of a top down of, we think that this is going to be the best thing to offer to this community. It's like, what is the community telling us? So I think that's the first part, is how do you figure out what the need is so you build around that? And then, obviously it's hiring the right people. It's hiring the people who are going to think about healthcare in a totally new way, which is, this is about supporting the person in front of you and not just like lecturing the person in front of you. It's listening to that person to say, like, who are you? What do you need? What can I help guide you with? And what can I help you achieve? Right? That's my goal. It's not to stand in your way. It's to help I have power in the fact that I'm somebody who can prescribe something. You in front of me are telling me that what is going to make you feel good is getting hormones. So great, let's work together and get those for you as quickly and as safely as we can. Like, that's my role. And I think that's the way that we have to, when I think about hiring the providers, it's people who are willing and ready to like break down the barriers to care for as many people as possible, especially in underserved communities. And then, obviously it's doing the training around all of the ways that we're going to do our intake forms, so that, again, the intake forms are based on, how do we ask this question in a way that is straightforward? We offer information that is clear and transparent to the people, easily understood. And we're only asking questions that that are needed. We are not asking superfluous random things that make no sense for the service that you're here for. And we are asking it in a way that shows that we know what we're talking about and that you can trust us. And that's both in the intake form, that's in anyone that's dealing with the people that are coming to see us. And, one of the things that we want to make sure of, there's partners that we're also working with, right? There's labs that we're working with. There's pharmacies that we're working with. We can't have control over all of those people and all of the interactions that, let's say, a Folx member has, which is what Leith pointed out, that one of the benefits of Folx is that everything is delivered to your home. So you actually don't need to have those often crappy interactions where you're misgendered, where people are not understanding why you're getting this lab versus this. All of those pieces that we can take away. But right now, there's plenty of people that we're sending over to, let's say, a Quest lab to get their labs drawn. We don't have full control over all the people who are drawing those labs or interacting with them. But I do say to all of the members, if you have a crappy experience, if somebody is treating you in a way that feels disrespectful or not empowering, you let us know. And then guess what we're going to do is take it on ourselves to figure out the next training to be able to bring to them, right? We will feed that back to them to say, these are our people. You have to train your people over there who are interacting with them in the way that they deserve. So I would say, yeah, that's kind of the whole thing about when I think about implementing the new program, is all the wraparound as well.
How do you assess that that training has been successful when hiring people?
Yeah, that's a great, so that's a really good question, because obviously what we're doing when we're hiring, like, are you talking about like hiring clinicians or hiring anyone? Yeah. So when we're hiring clinicians, we are like, part of it is a gut check, right? And we also have people on our hiring team who are trans. And so I would never, like, I am obviously, like, I'm a queer provider, I am not trans. I am never going to be the final say. If we are hiring someone for a particular service, I want the person who actually is going to be the receiver of that service to also be represented in a hiring committee and be making sure that people are being assessed that way. We want people who are personable. We want people who are know their, I keep on wanting to swear sometimes. I know we're on a thing. People who know their stuff and also are like warm and good people, right? Like you can be a clinician, but like if you're not warm and like caring, then maybe that's not a great fit as well. To assess how well they're doing once they're onboarded, you know, there's obviously the things that I have in my back pocket as like a quality management person. I'm checking their charts. I'm making sure they're actually prescribing things right. I'm making sure they're following our protocols. But I'm also getting feedback from the members about their relationships that they're developing with those people, right? We're sending surveys to say like, how was that? What's your take on it? Give us feedback. And then we would then give that feedback back to the clinicians and go from there in a roundabout way. Obviously, if there's ever anything where a member tells us that someone was disrespectful or you know, did not provide empowering care, then you know, there'd be for sure ways that we would deal with that clinician and possibly put on probation and go from there. Like obviously all of those things that we want, like our clinicians are our first line of resource and we want them to be the best.
Yes. I was wondering about navigating financial challenges when it comes to accessing LGBTQ specific care and necessary sexual health needs. How does folks, or just in general, how should someone go about that?
Yeah, navigating financial issues at Folx. So one of the things that our main thing is to obviously be as transparent as possible about the cost, right? We tell everyone upfront, this is what the monthly fee is and this is what it's included, and that there's no hidden fees after that, which is very different for me as a clinician. Like I can tell the member in front of me exactly what that cost of the medication is that they can expect versus if I were to prescribe it to a pharmacy, I don't know what their insurance is going to cover or not. And so there's, and same with labs, I don't know what's going to get bounced back. And so I don't have that toolbox, right? Obviously, then, as I was saying, we have HRT Care Fund for people who need that access. And eventually what our end goal is to drive down the cost of healthcare for everyone in terms of trans and queer care, because we'll have enough members to have the power to then say to the pharmaceutical companies, like, look, this community is large and this community is powerful. And now you get to listen to us instead of us listening to you. And the same thing with insurance is like, we work outside of the system now because the system is so broken that once we can help create like ourselves to be big enough and powerful enough as a force, then the system gets to listen to us.
How?
Can I ask a question as a member really quickly? Is that okay?
Of course.
So for example, if I needed, like right now, I just got my hormones and it's in this beautiful box and I was so happy because I didn't have to go to a pharmacy where, you know, they're supposed to be very aware of like HIPAA, but they're like shouting your date of birth and your first and last name and everyone can hear it. And I'm like, okay. But if I needed to see a specialist for something, how would that work?
Yeah, so what we're doing, we have a member support team, right? So if there's anything particular for, right, we are brand new and just starting out with a certain amount of things, certain amount of services. If somebody comes to us and says, oh, I need X, Y, or Z, then what we're doing is on a case-by-case basis, literally searching that out for that individual person, vetting it by our team of member support people. And then we would be adding it into our referral system. So it, like Leith, if you said like, I want to have a trans competent, I don't know, I'm trying to think of what might be, I mean, hopefully your shoulder is never hurt again, or like your back is hurt again. I need a chiropractor who's going to treat me with respect and be empowering and be great. Then what we would do, we don't have chiropractors on staff. We're not there. We're not in person, but you can then contact us and be like, look, I need you to help me look for this, and we will help you look for it and then add it to our system so that we can actually build this referral system across the country that is trans and queer competent and vetted.
No, how about for folks that might not be able to afford it? So like, for example, if there's someone that is a member with Folks, and can basically only afford their membership.
Yep.
And maybe if they need to see a specialist, like will there be out-of-pocket costs? I remember speaking to Rocco, and maybe they're working on possibly having like a Folks health insurance.
That's down the line at some point, where we're going to have some like a health insurance that we can both to help support our member, right? Like to have like an all-encompassing health insurance so that you could use here, you could use externally. If you had to go to a specialist that was not part of Folks, then yes, it would not be covered by the Folks membership fee. But one of the things in terms of the referral system and trying to get our member support to find you is they would try to look for places that had sliding scales that could get you into like also I've had the member support team like look to see, okay, I know this state doesn't cover top surgery, but what could we figure out that's going to be are there any other funds that you can look for that can help this person? Those kind of things that would, again, like it wouldn't be because Folks doesn't cover that. It wouldn't be covered under us, but we could help source that. Is that what you're asking, Leith? Okay.
Yeah, that's what I was asking. Yes.
Yeah.
This is a very general question, and both of you can answer in the ways that you can. But how does one self-advocate as an LGBTQ body? Within healthcare.
I mean, like I said before, I've never been one to shy away from it, just because I know that my being open and transparent can help somebody else. So for me, it's always important to be out and be visible and be loud, but I understand that other people may not feel safe, and may not be inclined to do so. Some folks are stealth, or some people just don't want to have that conversation at all times. But for me, it's important, and I think that I think it's important for my physician to know what medication I'm taking. So if I'm on testosterone and I'm coming in and I'm having any other issue, and they're looking to prescribe another medication that could have some sort of adverse effects, they need to know that all the things that I'm taking.
Yeah, I think what Leith is saying is totally like true in terms of some people have that ability to kind of advocate for themselves and can go in and have that feeling of security just by themselves. I think the other thing is if someone is feeling, let's say, more timid or uncomfortable or just brand new to a setting, bringing an ally with you, that's like, best friend, a partner, a family member. I know when I worked in clinic and still do on telehealth visits, like if somebody wants to have someone next to them and we talk, great. Obviously, I'm going to check to make sure that this is that the patient in front of me wants this, because I always have to check for that piece. But it is a way to, I always think like, obviously the main relationship is between me and the patient or the member. But if I can help incorporate the rest of their lives into their care, and then they get supported in that way, and they feel like their questions are answered, and that person is like on board with it, that's so much better, right? And so I think, and then that person then can feel like, okay, I'm supported I've got this comfort, I've got like a comfort animal next to me, and then I've got the person in front of me who's helping lead me on this.
I just want to thank you so much for the incredible work that you're doing. It's just hearing about it is amazing. I was wondering if within Folx, if there was anything else you wanted to platform or discuss.
I mean, I think that, yeah, it is. I feel kind of shocked and excited and amazed all the time. I feel overwhelmed by the amount of work it is, but I feel like what we can build here is like literally kind of breaking open healthcare in a way that's like, this is about you and this is about empowering you. That is a totally different way of healthcare. And so I mean, the platform is just like, we're building it. We're getting like adding new states all the time. We're adding new like services all the time. So, you know, we are working our asses off to try to get legal and live in all of these states. So just know that more people are going to be served at some point. And I think the main thing also I'd like to say is like, feedback is great, right? We want to know what the community is liking and what they're not liking, and also what do they want next. And we're getting that information everywhere, but it's always better to get it from more and more people in more and more diverse corners of the country. Like that is what is going to drive what we do next. So that's what I would say.
I would say I encourage everyone that's watching, and if there's anyone that has just needs resources, the Folx website has so many resources, and they're constantly updating the page, and they've done such an excellent job of having all these resources and frequently asked questions available, or answers to the frequently asked questions available for everyone to see. So I encourage everyone to visit the website.
Leith, that was such a great call out. My people who like run the library are probably going to be mad that I didn't do it, but good, you did it.
No,
yeah,
no.
it's so amazing. It really is. I mean, we source different articles. The clinicians are writing things. Community members are writing things to be able to say like, this is a resource for everyone. So I think one thing when we think about like Folx, maybe the membership fee might not be for everyone, but guess what? You get to go on there and read these articles, and you could actually access like, you might not always access the care from us, but at least you can access the information from us, you know, is a pretty big piece of it.
Yes, definitely check out the website, everyone. Thank you both so much for being here and talking with us. It's just so incredible to hear, and I really appreciate you both taking the time. Best of luck, Leith, with your performance.